reports from Yemen. We present a report about the fruits of the voluntary medical and social activities of the NGOs, the Charitable Society for Social Welfare, CSSW, and the Yemen Medical Charitable Society in areas of prevention and combating several endemic diseases in Yemen, especially in poor and deprived districts. Our medical teams work in voluntary bases and cover remote areas with rough terrain and extremely difficult road systems. Our working strategies could be summarized in the following points. Our voluntary force is about 12,000 all over the country. Our goals are to provide charitable work, medical, educational, and social to needy sectors of our people. 2. Cooperation and mutual planning with our country's health authorities is well functional and harmonious for several years. 3. We established working relationships with several international NGOs. We have been consulting member of the United Nations Economic and Social Council since the year 20. Since malaria, we signed an agreement with our Ministry of Health to combat and defeat malaria in Yemen. Through this national program, we conducted several functions, including one, geographic and epidemiologic studies and surveys, 2. Training in the field for our volunteers, workers, and the local communities, 3. Public education by all available means to orient the concerned local societies about the disease prevention and cure, field work using the necessary equipments and materials to deal with the vectors and breeding places, treatment of infected people. Until now 180 medical teams were dispatched to various affected districts to support from our health authorities as well as from international agencies was instrumental in the success and continuity of our efforts. Schistosomiasis bilharziasis, the disease is endemic in 11 districts in Yemen, where 5.5 million people are affected or threatened. Similar strategy as the malaria program is adhered to. Onchocerciasis, a chronic parasitic endemic disease that primarily affects the skin and may affect other systems, especially the eyes. The disease affects very poor and deprived people in 7 Yemeni districts through an international program named the above mentioned agreement covers also other disease entities such as fluorisis, leprosi, leishmaniasis, scabies. It is noteworthy to mention here is our society's outreach activities in the remote island of Socotra, 800 kilometers away from the city of Aden in the Arabian Sea. Our first medical team, in cooperation with the Ministry of Health, had to be transported via a military plane to the island. Various epidemiologic, educational training, preventive and therapeutic activities were conducted to the extremely needy poverty and disease stricken island population.